Everyone called retired nurse Grace old aunt. 64 years old, moved slowly, spoke calmly, worked part-time at Sunset Manor Retirement Home. Young staff considered her outdated, saying, "She doesn't know modern medicine," until the mass casualty accident when she calmly commanded Triage Protocol Alpha, critical cases first, prepare for field surgery. Grace Henderson arrived at Sunset Manor every morning at 7 a.m. She quietly made her medication rounds, spoke gently with elderly residents, and carefully completed her paperwork. The young nursing staff treated Grace as invisible. Head nurse Jessica Martinez often complained, "Grace is too slow, can't understand modern equipment. She struggles with electronic medical records." "Old school nurse," said CNA Brandon Taylor. "She's used to manual charts, difficult technology adaptation." When Grace heard these comments, she would just smile and continue her work. Nobody knew that those slow movements actually came from 20 years of combat medic precision. Every movement calculated, every decision deliberate. During lunch breaks, Grace usually sat alone at the corner table in the cafeteria, eating her sandwich while reading medical journals. But actually, she was memorizing every emergency exit, medical supply location, and staff movement pattern. "This woman isn't social," said Activity Director Lisa Chen. "She's worked here 15 years, never formed close relationships with any of us. Kinda weird." Grace didn't mind these gossips, because real friendships were elsewhere, or now in graves. The residents loved Grace. Mrs. Eleanor Patterson often said, "When Grace touches you, the pain decreases. She has a magic touch." Mr. Robert Chen also praised Grace. "This nurse is different. She doesn't just give medication, she actually listens to me." But management underappreciated Grace. Facility Administrator David Blackwood saw Grace as outdated. Grace is good-hearted, but can't meet modern healthcare demands. Grace knew this, but continued working quietly, because service was more important than recognition. That Friday afternoon, at 2:30 p.m., sirens were heard outside. Major highway accident, multiple vehicles involved, mass casualty situation. Sunset Manor was 2 miles from the accident site. EMS dispatch requested it be used as a staging area for transport to hospitals. Administrator Blackwood panicked. "We're not equipped for emergency medical care. Our staff isn't trained for trauma." Head nurse Martinez was stressed. "Sir, our residents' safety is priority. We can't handle outside casualties." Grace quietly listened to the situation. Automatic response plans were activating in her mind. Mass casualty events, triage protocols, resource allocation, muscle memory from 20 years ago. When the first ambulance arrived, 6 seriously injured patients arrived. The EMT team was overwhelmed. More coming. Hospital capacity exceeded. Need immediate triage. The nursing staff was in panic. Jessica Martinez: "We don't have trauma training. What do we do?" Brandon Taylor was confused. "These injuries are too severe for our basic care." Grace quietly approached the injured. Her eyes shifted to professional assessment mode. First patient, chest trauma, difficulty breathing, probable pneumothorax. Second patient, head injury, altered consciousness, possible intracranial pressure. Third patient, multiple fractures, significant blood loss, shock risk. Grace calmly said to Jessica, "I can help." "Grace, these are serious trauma cases. Your basic nursing." "Jessica," Grace said, the authority in her voice suddenly shifting, "I can handle this." Grace approached the first patient. "Sir, do you have chest pain?" "Difficulty breathing?" The patient weakly nodded. Grace immediately performed chest auscultation, assessed breath sounds, decreased lung sounds left side, probable pneumothorax. Jessica was amazed. "Grace, how do you diagnose pneumothorax?" "Start high-flow oxygen, establish IV access, prepare chest decompression," Grace continued commanding. Brandon was confused. "Grace, We don't have chest decompression procedures. Grace quietly went to the supply room, located specific equipment. 14-gauge needle, saline, chest tube set. How do you know where these are? Jessica asked. Because I memorized the inventory from day one. Emergency preparedness. Grace methodically established a triage system. Red tags, immediate life-threatening; yellow tags, urgent care needed; green tags, walking wounded. Young EMT Jake Morrison looked amazed. "Ma'am, you know military triage protocols." Grace paused. "I know what works." When the second wave of casualties arrived, Grace had already taken command position. Jessica, red tag patients to main room, yellow tags to activity room, green tags to cafeteria. Brandon, vital signs every 15 minutes. Document everything. Lisa, coordinate with families, establish communication center. Staff initially hesitated, but Grace's confidence was contagious. They began following her orders. When a critical patient went into cardiac arrest, Grace immediately started CPR. Compressions 100 per minute, ventilations every 30 seconds. She perfectly executed advanced life support protocols, defibrillation, medication administration, airway management. Jake Morrison whispered to his partner, "This isn't basic nursing. This is advanced emergency medicine." When Grace established IV access, her technique was flawless. Difficult veins, challenging conditions, but successful placement on every attempt. "Ma'am," Jake asked, "where did you learn advanced trauma care?" Grace paused. "Experience teaches you things textbooks can't." When the third patient had severe bleeding, Grace identified pressure points, applied hemorrhage control techniques. Direct pressure here, elevation, tourniquet if necessary. Tourniquet application? Jessica was amazed. "We never learned military-grade hemorrhage control." Grace quietly. "Some knowledge comes from places you hope others never have to go." When Administrator Blackwood came to the scene, he was shocked. Grace was commanding the entire emergency response, with staff efficiently working under her direction. "Grace, what's happening here?" "Sir, mass casualty management, protocols established, patient stabilized, transport coordination active. But I'm doing what needs to be done." EMT supervisor. Captain Maria Rodriguez arrived for scene assessment. "Who's coordinating triage?" Jake pointed to Grace. "That nurse, ma'am. She established military-grade protocols." Captain Rodriguez approached Grace. "Ma'am, your triage system is textbook combat medic procedure. Where did you train?" Grace hesitated. "United States Army. 91W combat medic. Iraq deployment, 2003 to 2005. The entire room went silent. Jessica's jaw dropped. "Grace, you were a combat medic? 82nd Airborne Division, medical support specialist, Operation Iraqi Freedom." Brandon couldn't believe it. "You never told us." "Because military service ended, civilian life began. Different life, different purpose." Captain Rodriguez respectfully. "Ma'am, what was your rank?" "Sergeant First Class." "Team leader, forward medical team." "Purple Heart recipient." Grace quietly. "Some recognitions are better left in the past." Captain Rodriguez spoke privately with Grace. "Sergeant Henderson, your military medical record must be impressive." "Captain, I didn't come here after retirement to relive war. I want peaceful service." "Ma'am, your response today saved lives, combining modern emergency medicine with combat experience." Grace thoughtfully. "War taught me medicine under pressure. Peace taught me medicine with compassion. Why retirement home nursing? After seeing young soldiers die, helping elderly live peacefully, it's healing for me." Captain Rodriguez nodded understanding. "Service comes in many forms." "Exactly." Later, Jessica approached Grace. "Grace, I'm sorry for underestimating you." Jessica, you weren't supposed to know. That was intentional. But why hide such incredible experience? Because combat medicine is about survival. Civilian medicine is about care. I prefer care. Brandon was ashamed. We called you outdated. You saw an elderly nurse. I wanted you to see that. Combat identity. Too heavy for daily life. Administrator Blackwood formally apologized. Grace, the facility needs your expertise officially. Sir, I'm happy as a part-time nurse. Don't need title changes. At least let us acknowledge your service properly. Grace considered. Acknowledge by letting me continue helping people quietly. The following week, the atmosphere completely changed. Staff approached Grace with new respect. Good morning, Sergeant Henderson, Jessica said respectfully. It's just Grace, Jessica. Rank belongs to a different time. Young nursing students visiting the facility for training asked Grace questions. Ma'am, what are the differences between combat medicine and civilian medicine? Grace thoughtfully answered, combat medicine saves life for mission continuation. Civilian medicine saves life for life's own value. Which is more important? Both serve their purpose. A soldier deserves to survive battle. An elder deserves to live with dignity. Residents sensed the change but didn't know why. Mrs. Patterson. Grace, staff is treating you differently. What happened? Nothing changed, Mrs. Patterson. Same care, same respect. But everyone seems more careful around you. Grace smiled. Maybe they finally noticed I actually listen. Mr. Chen was curious. Grace, were you always this good at emergency situations? Life teaches you to stay calm when others panic. Military service? Grace quietly. Some experiences shape how you respond to crisis. Months later, Sunset Manor became a regional training site for emergency preparedness. Grace reluctantly agreed to consult. Ma'am, young EMT students asked, what's the most important lesson from combat medicine? Grace thoughtfully. Every life matters equally. Rank, age, background irrelevant. Medical need determines priority. What about courage under pressure? Courage isn't the absence of fear. Courage is functioning despite fear to help others. How do you stay calm in emergencies? Focus on what you can control, accept what you cannot, act on what you must. Hospital administrators visited, requesting Grace join the emergency response team officially. Thank you, but no. My service now is here, with elderly who need gentle care. But your skills are available when needed, but my preference is quiet service. The local newspaper wanted a story about hero nurse. Grace declined the interview. Heroes are soldiers who didn't come home. I'm just a nurse who uses experience to help. Grace returned to her regular routine, but with new understanding from colleagues. Medication rounds continued, but now staff observed her technique, precise, efficient, caring. Emergency situations were handled differently now. Grace's quiet competence was recognized and respected. Young nurses asked for advice. Grace, how do you make patients feel so comfortable? Listen more than you speak. Touch with intention. Presence is sometimes more healing than medicine. What about dealing with death? Grace paused. Death is part of life. Our job isn't preventing death. Our job is ensuring dignity, comfort, peace. Residents felt safer, though they couldn't articulate why. Grace's presence had a calming effect. Mrs. Patterson, Grace, you have special energy, peaceful but strong. Mrs. Patterson, peace comes from knowing you've done what you could for others. Were you always this way? War taught me how precious peace is. Every quiet day is a gift. Today, Grace still works part-time at Sunset Manor. Same schedule, same gentle care, same quiet service. But now staff understands gentle hands can also be healing hands. A quiet voice can also be a commanding voice. An elderly nurse can also be an experienced warrior. Grace teaches by example. Service doesn't require recognition. Expertise doesn't demand spotlight. Strength can be shown through gentleness. Combat medic skills serve a peaceful purpose now, helping elderly live their final years with dignity, comfort, medical excellence delivered with compassion. Military training transformed into civilian healing. Battlefield experience became bedside manner. Combat veteran became community caregiver. Grace Henderson represents countless veterans who choose quiet service after loud battles. They don't seek recognition. They seek purpose. Their greatest victory isn't surviving war. Their greatest victory is choosing peace. If you believe people who serve quietly are actually the strongest, write respect for Grace, because real heroes serve peace after surviving war.